So I had these heavy bleedings, just different things, and I was thinking it was my hormone. Several attempts, going through naturopathic, spending all this money, just doing what I thought was good. I so happened to go to my primary care, realized there were fibroid there, and so I'm like, okay, I understand why I had the pain, the heavy bleeding, just all the different things that were going on in my body.
A fibroid is a benign tumor of the uterus, and that means that the muscle portion of the uterus starts to grow and creates this separate mass that can cause a variety of menstrual symptoms or pain for patients. It's not cancerous, but it does grow separately from the uterus, and that's why it can cause issues that require treatment.
I was a little discouraged, not a little, I was a lot discouraged. And so when I came home, I just began to look on the internet, and the first thing came to mind, I did look up Mayo Clinic, and I came across Dr. Louie. I made my appointment, and it was so reassuring. And I had a peace. I had such a peace being there with her that, okay, I don't have to live with this. I don't have to live in discomfort.
Andrea had a myomectomy. A myomectomy is a procedure in which we remove the fibroid from the uterus. That requires making a skin incision and then a uterine incision to remove the fibroids. And then we repair the uterus so that it's functional for future pregnancy. The way that we did that for Andrea's case is laparoscopically, so there were 4 small incisions in the abdominal skin, and that's what we consider a minimally invasive procedure compared to a large incision like a C-section incision or an up and down incision. Radiofrequency fibroid ablation is one of the newer techniques we have to treat fibroids. It's a very popular treatment because it allows for preservation of the uterus, so we don't have to remove the uterus. And it's also a very minimally invasive technique to treat the fibroids. There are 2 ways to do the ablation of the fibroids. One is vaginally with no incisions at all and a very short recovery time of 1 to 2 days. And the other is laparoscopically with just 2 small abdominal incisions and a recovery time of about 5 to 7 days. So these procedures are very minimally invasive and have a very short recovery time, which is very important to our patients, of course.
The entire experience was good. Just going in, as I said, Dr. Louie let me know this is what's going to be done, and after surgery, this is what you need to do. And this may not be for everyone else. I didn't have to take any painkillers. Like I said, the pain, there's no pain. There is no pain. There is no heavy bleeding. So that's, for me, that's awesome. Quality of life.
The most important thing I would like patients to know is seek out a fibroid specialist. If you are having menstrual issues or gynecologic issues, don't accept no for an answer and get your questions answered. Make sure you're satisfied with the answer and seek a specialist if you're not, because there are a variety of options available to you, and we want to make sure that you have access to all of them.
There is help. You don't have to live in discomfort, and be at peace. Be at peace.